Hey everyone, so today we'll be doing another mock USMLE Step question. This will be question number 10. So question is, you have a 26-year-old male who comes to the ED with acute onset of diarrhea. He reports that the diarrhea began early in the day, is watery in nature, and is associated with occasional abdominal cramping. He denies any fever, nausea, vomiting, or any blood in the stool. He also denies any recent travel history. On physical examination, patient appears well hydrated and his abdomen is soft and non-tender. What is the next best step in the management of this patient? Options are conservative management, obtaining a stool culture, getting oral antibiotics, or stool ova and parasites. Feel free to stop the question, pause it here if you need more time. So the correct answer is conservative management. This is a very high yield question for USMLE Step exams and NBME. Whenever you have a patient with gastroenteritis, particularly if it's non-bloody and just watery in nature, the vast majority of times it's viral in nature and you don't have to give any antibiotics. You can just manage it conservatively, particularly if the patient doesn't have any signs of hemodynamic distress. So once again, gastroenteritis, it's most frequently viral in nature and you can just manage it conservatively. You don't have to give them IV fluids, you don't have to get any blood cultures, you don't have to get any stool cultures. Manage it conservatively. Now let's look through the other option and talk about when you might actually get those. The second option is stool culture. You will get stool culture, say if the patient came in and he or she is reporting that they have bloody diarrhea. In that situation, you would obtain stool cultures. But even in that situation, you would manage the patient conservatively. So you could get stool cultures and have the patient just follow up outpatient if the symptoms don't get better. Third option is oral antibiotics. Oral antibiotics, in the vast majority of cases for patients who have gastroenteritis, is going to be the incorrect answer. The reason is, if it's a viral form of gastroenteritis, if it's a viral organism that's causing gastroenteritis, antibiotics aren't going to help. Even if it's a bacterial cause, often antibiotics can make it worse. And what you have to remember is, for patients who have gastroenteritis from enterohemorrhagic E. coli, giving them antibiotics can actually increase the incidence of hemolytic uremic syndrome. So that's why you typically avoid antibiotics for patients who have gastroenteritis. And the last option is stool ova and parasites. You will typically get these if a patient comes in for diarrhea for more than a couple of weeks. You're not going to get that for a patient who has acute onset of diarrhea, which is once again going to be typically some viral cause or a bacterial cause. So once again, the key thing to remember for this question is, for a patient who has uncomplicated gastroenteritis, manage it conservatively. Often, to make this question tricky, they'll give you these options. They'll say, oh, you can give the patient antibiotics, you can get a stool culture. Don't get those things. Just manage conservatively and have them follow up with their primary care doctor, or return to the ED if symptoms don't improve. And that will be it for today.